Some of the most common sports injuries are knee-related injuries, especially related to the growth plates around the knees. We also see a lot of ankle injuries and shin injuries. But in people who are in throwing sports or overhead type of sports, we also see shoulder injuries. I would say that a good way to prevent injuries is when you're getting into your sport to make sure that you gradually increase your activity, making sure that you're getting some rest throughout the season, so getting at least 1 day of rest throughout the week, and then making sure that you're cross-training, so using different body parts throughout the year, especially if you're in a sport, the same sport throughout the entire year. If you're starting to have an injury that may be of concern, is that you might notice that you have pain after you've participated in your sport in that body part. And then gradually you start to have pain while you're participating in that sport. And then sometimes you start having pain just at rest, so even before you started to participate. And those are all like the progression of starting to have an overuse injury. So that first sign of a nagging injury and it seems to be persistent, that's something that you want to pay attention to and see someone for before it becomes a bigger problem that prevents you from being able to do your sport. If you get an injury, as far as getting back into your activities, certainly a good idea to see your medical provider and have them evaluated. There's often treatments we can do like physical therapy. Physical therapy is a really great thing that you can do to, for one, get over your injury, but then build back up your strength and your flexibility in your sport-specific activity to be able to get fully back into your sport. So what we're looking for is that you're able to do the activities of your sport safely and then be able to return to the field or whatever your area of play is.